welcome back to my channel. It's Rachel. I am in day 4 of countdown to 2021. Today's video is a little bit different than my typical video on this channel, and it is more a medically minded video. Just a caveat or a little refrain here for those that don't know I am an ER doctor. I am going to talk today about the pandemic and some new information since I've done these last update videos, and I want to make sure that you guys know that obviously this is I'm not giving medical advice. I always have to do this legality type thing, but I just want to give some information and education points, and you guys can do with that information what you feel is important. So the last time we did one of these update videos was, gosh, it was a long time ago. It was this summer, maybe like, I want to say like July or August. And I took a big break from these videos. And at that time I had been doing live videos on this information, but I took a break. We had reached a nice little plateau from like August until probably October in Texas, specifically here in San Antonio. And I didn't feel like I had a lot of information to give you guys or anything new. But in the recent past weeks, specifically in the last month, things have just taken a turn for the worse, and the pandemic is not done and things are kind of out of control. And I have had a lot of you guys ask me to give an update, and so I felt like there was some new information and things to go over and kind of give you guys a feeling of what's going on right now. So just to start, I like to start with numbers of where we are about this, and I have my phone here, so I'm going to pull up some numbers of where we are with COVID. Okay, so just a background, I'm sure everybody knows what COVID is. COVID-19 is a coronavirus. This is a novel virus or a new virus, and it showed up, originally we thought it showed up around January in Wuhan, China. What we're now understanding is that this virus looks like it was around earlier than that, probably potentially into November in China. And they think that in some cases it was probably in parts of the US as early as December. A lot of us in the healthcare field really do believe that that makes a lot of sense. When you think about some of the cases that we saw that didn't make sense back in December and January when we didn't think it was here. Originally, I work in San Antonio. I thought that this had gotten to the San Antonio area in March. We now know that that happened a lot earlier. And so it's kind of changed our thoughts a little bit on this. Originally, with this virus, we did not think that it was spread by asymptomatic carriers. That's why there was so much confusion on things like mask wearing. The CDC changed kind of what they recommended. Do we wear a mask? Do we not? And this caused a lot of strife with people, and this has really become a politicized issue when it never should have become a politicized issue. What we know now that we didn't know in the beginning is that this virus is asymptomatically transferred. And we know that mask wearing, when everybody wears masks, it decreases the transmission rate. We know that it is more effective to wear the mask to prevent yourself, let's say you're an asymptomatic carrier, from spreading it to everybody else. But there is some thought that it is slightly protective to those who wear it. Now, depending on the quality or type of mask you wear depends on how protective it is. For us in healthcare, we wear N95s or respirators or those big hoods that you see in like the movie, like not Contact, what's the movie? Like the different movies that have like different Outbreak, that's the movie. And those provide a much higher level of protection. Then you have a mask called a KN95. I have talked about this in my comment sections and stuff. That's the mask I wear when I go to the grocery store or to a shopping market when I'm not at work. That mask is a equivalent from China that is supposed to be the same protectiveness. Most of them have ear loops. They don't fit around your face quite as well as an N95, which has to be specifically fitted for a face. So I don't think it gives as high of a level. And then you have the next level, which are different types of cotton and surgical masks that don't have quite as much of an effective wear, but still are very protective to those around you when you wear one. So I will always message, and I think any of us in healthcare will message, wear a mask. There's a few oddball doctors that for whatever reason have decided to politicize and say that masks are not necessary. That's not what the science is saying. And please, 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 if something doesn't make sense, take a look, see what the CDC and other, people who have a background actually say. All right, so I was going to get into the numbers. Let's start first with Texas. So when we last talked, our numbers were somewhere in the 100,000 range. We are now at 1.31 million cases in Texas alone. We have over 22,000 deaths in Texas alone. That's terrible. That is terrible. We already know that this is far more deadly than the flu. Now, it is not as deadly as we first thought, but it still has killed more people this year alone than the flu season has killed many years in a row. So this is not a virus that we should take lightly, and it is still going to cause a lot of havoc in our environment and kill a lot of vulnerable people. There is some good news on the horizon. We'll get to that in a minute. Let's talk about specifically, let me see, let me pull this up here, how many in the U.S. I think we jumped from 13 million to 14 million in like a week in the U.S., but I wanted to double check that. Yes, so we just recently jumped to 14.2 million. We were like at 13 million only like a week or so ago. We have had over 276,000 deaths in the U.S. from this. That's terrible. And worldwide, it's like 40 some odd million, or no, I think it's even more than that. I think it's like in 100 million. It's a lot. A lot of people have gotten sick with this. Now, so people don't freak out. These are big numbers. We have a large population in the US. It sounds terrifying and scary. And a lot of people have had it. A lot of people get this and don't realize it, and they have very minor symptoms, and they are relatively healthy, and they don't get sick badly with it. And that's what we hope with most people. But there are still a subset of the population, for whatever reason, that gets really sick with this. And when they do, they get sick badly. And there are some folks that are higher risk, and we know this. So we know that those folks that are older, who have comorbidities like obesity, diabetes, and less so lung disease. We used to think that was a higher risk, but heart disease are the ones that do badly with this. And when they do badly, they end up really sick with organ failure. And some of them, although we try to keep them off the ventilators because we have now learned that that is not as helpful, will end up on dialysis and on ventilators. We're seeing a lot of folks get what's called a pneumothorax, which is where they get popped lung, basically would be another like layman's term for it. Basically, the pressures of all the oxygen we have to give to these folks causes them to drop or pop a lung. And that means that they have to get tubes in their lungs to help pull out that air where it's not supposed to be and reinflate the lungs. These can be very deadly. They kill people. We're also seeing a lot of clots with this disease state. And so we're seeing a lot of folks that get what are called DVTs, deep venous thrombosis, in their legs, and then they shower off clots into their lungs. We're seeing a lot of heart attacks from this. They clot off their vessels to their heart, and we're seeing a lot of strokes. So when it does go bad, it goes bad very badly, and people become very debilitated. There are a few folks that have ended up having to have lung transplants. Their lungs get so ravaged from this disease that they end up like cystic fibrosis lungs that are just so scarred down that they can't work properly. And they've had at least 2 double lung transplants, I believe in the San Antonio area or somewhere in Texas. I don't know the specific place, but they've had 2 that I know of where they were healthcare workers. We know there's a dose-dependent part of this virus. So we know that if you're exposed at higher levels, that you're likely to get more sick from it. And so we think that's why healthcare workers in the beginning, when they didn't have proper masks, PPE, protective personal equipment is what it's called, were getting really sick, and young, healthy doctors were getting really sick, and some dying. So we know this, and that's another reason I say masks are good, because even if you get exposed by wearing a mask and it's not 100%, it still lessens your exposure. So if you do get it, you're more likely to have a minor asymptomatic disease state from it. So knock on wood, in my group, we have not had anyone seriously ill with it. The few people we've had who've gotten ill have had relatively minor disease. And I attribute it to the fact that our group has done a really good job of wearing protective personal equipment. Our hospitals are much better now. We have lots of protective personal equipment. I can get a fresh mask every day. I'm not having to reuse my gear, which is fantastic. That was not the way it was in the beginning. And that is a very good thing, because we now know that if you wear an N95 more than 2 times in a row, it fails a big chunk of the time. And so that's why we think a lot of people got sick in the beginning who were still wearing the gear. Okay, so those are the numbers. Let's kind of go into some positives about this. I've talked about a lot of the really bad, like how sick people get. The positives about this: we know that this is not affecting the children population hardly at all. And it doesn't cause a lot of admissions for children. We know this, we're seeing this. And so the American Pediatric Society, I forget what they're actually called, came out and basically said, we're doing more harm by keeping children at home than good. They don't get very ill, they don't do hospitalizations, they generally are not spreading, they're spreading it, but generally, if they are in an environment where they're wearing masks and the schools are taking proper precautions, their risk of getting really ill from this are very low. The only place where it becomes a little hairy with this is if these children are then around folks that are more vulnerable, grandparents and such. Then that becomes a risk benefit that you as a parent would have to decide, is that risk that my child could be an asymptomatic carrier and give this to a vulnerable family member? And there is no right or wrong answer to this, okay? Because every family situation is unique, but the risk of kids missing out on socialization, education, isolation, that's all happening. And I can tell you from personal experience with my children. Now, my son is not in school yet. He's still too young. But my daughter loves school. And she did well with online, but she is doing so much better in person. And, you know, we had the option after Thanksgiving when the numbers started rising to put her back online. And we've chosen to keep her in school, knowing that this could be a risk that she could bring it home. And we understand that risk. But I feel comfortable with my school's policies. And I think the benefit of her being there is important. We also know children under, I believe it's about the age of 8 or 9, are less of a risk of getting it or getting ill with it and passing it on. It seems to be the older children, the high school age, the junior high age, that are more likely to pass it on. So I would say if you're on the fence and you don't have a high risk person at home, just keep that in mind about children in school. Other bright note, we have much better treatments for this disease than we did when this first started. Being a novel virus, we just didn't know what to treat it with, and we had to try to figure out on the go, and it was constantly changing. This is the thing about science that I think a lot of people don't understand, that we will hypothesize, do something, and then if we're wrong, we switch gears. And that's a hard thing, because politically, when you have politicians that change what they tell you to do, it's considered bad. You're not sticking to your guns. But in science, it's a good thing. It's a good thing if we see something fail and we switch gears to something new. That is how science works. So this is a very confusing prospect to the general public, and they don't know how to handle it sometimes. And it made it very difficult, where people were like, but you said this and then you didn't. So for example, we tried ventilators in the beginning. We treated it like a condition called ARDS, acute respiratory distress syndrome, where the lungs get very wet and don't oxygenate well. Although it sometimes looks like that, we found that this didn't quite work the same way, and putting them on a ventilator early not only didn't help, but was more harmful. And when you tried to get them off the ventilator, they would have their heart stop or have a heart attack, and these people didn't do well. So in the beginning, we had a lot of people that got put on a ventilator early and then died because of that. And we shifted gears and we allowed people to stay low on their oxygen, which is very different than what we normally do. In the past, if someone was at an oxygenation of 90%, I would have freaked out and been concerned. And now I am sending people home with oxygen saturations above at like 91, 92. That's new, that's different. We've had to change our practice, but we know that it's okay. The other thing that we learned, and we tried many different drugs. Some were complete awful and didn't work, like hydroxychloroquine. Some have been very promising. In the beginning, we were very anti-steroids because it looked like it was causing more harm. But when there was a good study out of England that showed if you used it in a subset of the population that required oxygenation, not only was it not harmful, it was extremely helpful. And this is a very cheap and effective medication that has done a world of good. We've been using a drug called remdesivir. We are starting to now learn, we initially used it for the sickest, but we're now learning that the earlier you give it, the more likely it will be beneficial. And now they have a monoclonal antibody. That's what the president got, and I believe some of the other politicians that got ill. And that is getting released to everybody. And so far, it looks like the earlier you give that, the better. It's going to be coming out to a lot of communities, but don't expect to be able to get that immediately. Like if you're minorly ill, they are going to have very strict criteria on who gets this. It's an outpatient infusion, meaning they're probably going to set you up with some sort of appointment at an ER or an infusion center. And you really are going to have to meet certain criteria. I think they're going to save this for people who have like cancer or very elderly or lots of comorbidities. So your average person who's relatively healthy is not going to have access to this initially. It's also extremely expensive. And it'll be interesting to see how people do with this. So it is promising. The final thing that is coming out are the vaccines. There's two big ones. There's the Moderna one and the Pfizer one. One is a mRNA technology, which is new, that's supposed to be pretty effective. And then the other one is more based on kind of like our older model of how we do vaccinations. A lot of people are leery. I will tell you, it is something we've never done this quickly before. Vaccines take years to do, but I do trust we have some great scientists that are really looking at the data, and it looks like it will be helpful and effective. And I think that's something that people need to look at and make their own decisions. For me personally, I will be getting the vaccine, and the government is coming out with like a phased approach on who's going to get it. And it looks to be that the most affected people are going to get it first. So healthcare workers, i.e. I think I'm going to be in one of the first groups, nursing home patients, and then they're going to go to different frontline workers first. So by the time it comes to the general public, you guys should have a pretty good idea if there's any badness, because all of us will have gotten it before. And I want you guys to know that if we're willing to do it, we're not going to give you guys something that could be harmful. Okay, but it is a step to trying to get us back to normal. It looks like the vaccines are going to hit the first wave of people like healthcare workers sometime in December, but I don't think it's going to get to your average citizen until probably early spring at the earliest. I think we're still going to be in a state where we have to wear masks at least till the summer, and maybe further along, because it's not just like you're going to get this shot and then you stop wearing a mask. That's not how it works. There are going to be multi-stages of getting these vaccines where you're going to have to get one or two, like a booster shot. So keep that in mind. This is not going to be over just when the vaccine comes out. And I've had to be telling family members this because a lot of people are like, oh, we're going to get the vaccine and everything's going to be okay. It's not quite like that. I am more ready than anybody to be done with this. I think that this winter is going to be one of our most challenging winters ever in healthcare. We run on razor thin margins in healthcare here in the US. In winter, it's not uncommon to run out of beds and have to hold people in the emergency room. We're not seeing a lot of flu. We're seeing all the other stuff that got put off, and we're already holding to capacity, and this is a national problem. COVID is exploding all over the nation. It's not just one hotspot like it was back in in June or July. It's everywhere is exploding. All the states, everywhere is just having a large number of this. And so unfortunately what's happening now is everybody that put off healthcare earlier is now needing healthcare for their different things, their strokes and their congestive heart failure they put off. So we're dealing with all of that. And we don't want those people to stay home. But now we're getting at capacity with COVID and the COVID related illnesses that come with it. And you have a healthcare population or a healthcare worker pool that is exhausted. My nurses, my techs, all of us are exhausted. We've been doing this for almost a year and we're tired, we're overworked. And I am worried it's just going to get worse. I've seen people leave in mass amounts from the emergency rooms to go to different careers or fields. Our nurses are cutting out because they're done, and I don't blame them. And so that is making it a problem. There is no ability to say, okay, today the hotspot is San Antonio. Let's send all of our available travel nurses there because everywhere is breaking out. And so you're going to have a case, and we're already seeing it, where a rural hospital will not be able to transfer a really sick patient. And they're going to have to figure out how to take care of that patient with limited resources because the cities are full and the ICUs are full, and we are going to see mortality rates go up because people are not going to get as good of care when the hospitals are overbooked with patients and we don't have the people to provide the care. And so why is it so important for us to follow the rules of wearing masks and socially distancing? This very reason. If you have a heart attack, you want to be able to be taken care of. And I'm a little afraid that that may not be the case if we keep up with this. This third wave, as we call it, will probably be a very long, smoldering third wave. Because what's happening is we have the election and Halloween started bumping it up. People are having pandemic fatigue and they're tired of not seeing their friends and family. So they think their friends and family are okay. We're seeing the biggest outbreak of this from people spreading it to their family members by getting together for a small birthday party or going out to dinner with their family member or having Thanksgiving. And I can't tell you how many people have said, oh, I got it because my brother had it and I didn't know it and I went to Thanksgiving dinner. So we have that. We're about to see another big bump, I think, from Thanksgiving this coming week. And right when that happens, we're going to be going into Christmas, Hanukkah, all of the holiday stuff where people want to be around their family members, and that is going to bump it again. And then you're going to get New Year's. So I think it's just going to keep bumping. People are exhausted and it's hard. Like I'm not going to get to see a lot of my family for the holidays. We keep our circle very small. I'm tired. I want to see my friends and family. I will tell you, in my own family, it's personally affected my brother. He got COVID. I couldn't see him for the holidays because he had to stay where he was at and he couldn't come down to see his family. And so please just think of that maybe this year, as tough as it is, maybe do a Zoom holiday. Like, get everybody on your family on Zoom and talk and chat, but kind of try to stay from everybody. And that's hard. And I know that's really hard, but it's going to be a really rough winter. And like I said, healthcare workers, we're pleading with people, please just try to tough it through this holiday. I know it's going to be hard. So yeah, that's how it's going to be, which really is going to be rough. Now, my thoughts on lockdowns and stuff. I don't think we should fully lock down again. I know that sounds weird. I'm pleading for everybody not to hang out with family members. But I don't think it's good for our economy. I think there's a phased approach. We can kind of like, when a place gets totally overrun, let's say like El Paso did recently, then yeah, you cut down capacities at restaurants, you shut down bars for a while, but you don't do a full, complete lockdown of an entire state. But I still am truly a believer that the local health care policymakers, those people know the place the best. They should be able to ramp up or ramp down when things open or close. For example, here, I think our city's getting close to starting to phase down elective surgeries. We're at that point. We're going to have to. And maybe we're going to get close to needing to back off occupancies in restaurants because we know that this is spread more indoors and it's getting cold and people want to eat inside. So, these are things that people need to be mindful. I'm not saying we should shut fully down. I think that would be a bad idea. People need to be able to make a living, but we need to have a give and take when things get bad to shut things down a little bit, to slow this down. And people need to be okay with not seeing a relative or a friend for a little bit. I know it's hard. So that's it. I kind of went through a lot. I know you guys probably have lots and lots of questions, and I will try to do another one of these update videos. Maybe I'll do it every other week or every week. It just depends on how the situation goes. So if you guys put the information down below of what you're interested in hearing about, you know, questions you have, I will try to address it in the next video for you guys, because I know that there's always questions. But yeah, it's getting bad. I'm seeing a lot of COVID. I feel like we're not quite to where we were in July, but we're ramping up there with admissions and everything. So, but yeah, that's it, guys. Thank you so much for watching. We'll do a more fun video tomorrow that's not so heavy on pandemic stuff. But I'll see you later. Bye.